talk about the S sound. Welcome back to my Sound of the Week series where I'm going to give you strategies for elicitation. Hi, I'm Amy Graham. I'm a speech-language pathologist in Colorado, and I specialize in speech sound disorders. My first big tip would be differentially diagnose what's going on. What is the child doing instead of S? Because my tips will be different depending on how they present. Are they stopping the S sound, where instead of soap, they say dope? That's stopping. That's a phonological error. Or are they lisping? Do they say thope? That's an interdental frontal lisp. Or are they lateralizing? Do they say shope? My strategies will be very different depending on all of those subtypes of speech sound disorders. So if a child is stopping, first tip, if you're an SLP, choose a phonological intervention because that will help you determine what you're going to target in therapy, and you will likely be saying at the word level to help teach that child the rules for when you use S and when you use other sounds. Maybe you'll use minimal pairs, or the cycles approach if they have more errors, or the complexity approach if they're missing a lot of errors. So my favorite cue for kids who have phonological errors is that metaphor cue, the snake sound. Get your picture cues out, get your metaphor cues out, get your gestural cues out, and just talk about the snake sound. Elicit it like it's a sound effect. Once you can elicit that sound, move into word level production as per the phonological approach that you have chosen. And when you have a child with a motor-based articulation distortion, like a frontal lisp, an interdental lisp, a palatal, a lateral lisp, a lot of those distortions can co-occur with underlying myofunctional issues. So it's important to do your assessment, identify whether or not there could be any structural or functional contributors that might keep that child from producing that sound accurately. So do your assessment, do your analysis. But if you're eliciting S and it's distorted, consider phonetic shaping. Do they have other sounds that are similar in tongue placement that they are also producing accurately? For example, the T sound. T. If you can say the T sound and hold it out, t, you get a very well-placed S sound if you have a frontal lisp or a lateral lisp or a palatal lisp. There are so many types of S errors. If there's a specific one that you struggle with, comment below. Follow for next week's sound.